Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston, Texas. In this presentation, we're going to look at how to greatly reduce your heart disease risk. There's a direct correlation between your cholesterol level and the risk of heart disease. We're going to look at the various components of the cholesterol and triglycerides and how they greatly increase the risk of heart disease and how you can bring down that risk by modifying your cholesterol levels. Let's start off with the total cholesterol level. The total cholesterol level should be less than 200. As the cholesterol level goes up, here's my arrow you can follow, you can see an increase in the risk of heart disease. And then also we have here the triglycerides. When we are talking about cholesterol, we are mainly referring to the LDL cholesterol, which is the low density lipoprotein cholesterol, which directly increases the risk of heart disease. So if the LDL cholesterol is greater than 130, it has a greater risk of heart disease compared to an LDL level of 80 milligram percent. On this axis, we have the HDL, the good cholesterol. The higher the good cholesterol number, the lower is the risk of heart disease. As the HDL level gets lower, the risk of heart disease goes up dramatically. So if you combine a combination of factors like high cholesterol, high triglycerides in excess of 200 milligram percent, along with the HDL, the good cholesterol, which is less than 35, your risk of heart disease is going to be 15.9 compared to a person with a total cholesterol of less than 200, a triglyceride level less than 200, and an HDL level greater than 35. That person's risk is approximately like 4.3. So this is clear from this chart that as your cholesterol level goes up, as your triglyceride level goes up, and as your HDL level comes down, your risk can be 4 times that of a person at the other end of the spectrum. If you're in this spectrum, if you have an HDL level of less than 35, if you have a triglyceride level of greater than 200, and you have a total cholesterol of greater than 240 milligram percent, you have good news. And I'm going to tell you how you can dramatically reduce this risk by simple modifications. Number one, we would like to bring back the triglyceride levels. Number two, we would like to reduce the total cholesterol levels. Number three, there are some methods by which we can increase the HDL level. So let's talk about each one of these. The total cholesterol level is a reflection of the LDL level, the HDL level, and also the VLDL as it is called. You can reduce the total cholesterol level by reducing your cholesterol intake, but with diet alone, you can reduce this number by a maximum 25 milligram percent. If your cholesterol level is 240, just the diet alone is not going to help. It will help, but it's not going to bring down the level to less than 200 or maybe 160 as people would like to see it. In order to do that, there are medications, namely the statins, which can reduce your total cholesterol level by 40 to 50%. So that's step number one. Step number two, triglycerides. Higher triglyceride levels are seen in obese patients, in patients with diabetes, and reducing the triglycerides is of great importance in reducing the risk of heart disease. How do we reduce triglyceride levels? We reduce the intake of carbohydrates, we reduce the intake of fat. That will bring down the triglyceride levels. There are medications which can dramatically reduce the triglyceride levels also, like gemfibrozil or tranquil. How do we increase the HDL level if it's less than 35? That's a tricky point. Number one, the cholesterol reducing medications do increase the level of the HDL. But in order to increase the HDL level, you need to get involved in an exercise. If you get involved in a regular exercise program, if you control your triglyceride levels, if you control your blood pressure and blood sugar, that will increase your HDL level. As a result, you can bring your HDL level up. So to summarize, you are not only trying to reduce heart disease risk, but in the process, you're reducing your triglyceride levels, you're improving your HDL level. In order to get to that point, you have to control your blood sugar, you have to control your weight, you have to control your carbohydrate intake, you have to control your fat intake, and get involved in a regular exercise. And when you follow these simple steps, it is not far from reality that you can dramatically reduce your risk of heart disease, say from 14, 15 to almost 4 to 5. So that is a very dramatic change. I hope this has been educational to you. We have a number of presentations on heart disease and heart disease management. Please do watch those videos and please do subscribe to our YouTube channel, and I will see you in the next presentation. I am Dr. NIK NIKAM from Triple N Media. Thank you so much.